is divided mainly into two parts: cervical spondylosis and the lumbar spondylosis. The main cause is disc herniation. These discs, they are the cushions in the vertebral column that absorb the shocks and the stress traumatic injuries inflicted to the bones or the vertebra and spines of the spinal column. Now the symptoms of the spondylosis. Symptom is similarly divided into two areas: cervical area, one the neck area, and the lumbosacral area, or the upper buttock area. So cervical or cervical spondylosis, there is severe shooting or the electric shock like pain in the neck and the upper arm going to the hands and the terminals of the fingers, and the back to the interscapular muscles. Then there is tingling and numbness, which is called as paresthesia. There is disturbance of the bowel and bladder reflexes and incontinence of these functions. The pain radiates and goes along the line of the nerve and its tributaries, which has been compressed. Diagnosis of the spondylosis. The main cause of the spondylosis, whether it is cervical, whether it is lumbar, is disc herniation. That is degeneration in the disc size and the diminution in the function of the disc to absorb the shock. And this pathology of spondylosis occurs at the age of 60 years, elders one in case of cervical spondylosis, and usually it occurs near about 40 years in the cases of lumbosacral spondylosis. The lumbosacral spondylosis is also termed as, in common language, sciatic, because in this pathology, which is compression of the nerve, but it is a bundle of nerve fibers, which is called as sciatic nerve, and it passes from the foramen or the exit pores or holes of the spinal cord into the buttock behind the muscles, and that passes along the back of the thigh, back of neck into the feet and the toes. The muscle which is undergo spasm, contraction, and then produces swelling, inflammation of the nerves. So that produces the obstruction in the conduction of the orders, which are coming from the head center of the brain through the spinal cord into the muscles of the body of the body. So actually it is a neurological problem. The diagnosis is mainly depends on the radiography, X-ray, neck spines, lateral and epigloss, to detect the alignment of the spines, condition and size of the intervertebral discs, their extent of degeneration and extent of herniation, and the location and site at which it occurs. Then next is the detailed study of the full spinal cord, spinal column, spinal cord, and the nerve and the roots that is going out of the spinal canal by the MRI. By this method, we use magnetic force as well as the radioactive radiation force. To detect the condition of the spines, vertebral canal, any obstruction by tumor or cyst, soft tissue, ligaments, condition and swelling of the ligaments, in any sort of obstruction which is in the pathway of the normal passage of the nerves which are coming from the spinal column and going out through the holes into the muscles of the body. Then next we can perform CT scan, and this is also assisted by the injection of the radiopaque dye into the spinal canal to visualize the complete inner picture of the spinal column. By this procedure, detailed study of the obstruction and the pathology extra to the obstruction produced by the bony degeneration by the tumors or cysts, etc. Then we perform electrobiography. By this process, we estimate the intensity of the currents which passes from the nerves into the peripheral muscles. And also, moreover, we can judge or estimate the neuromuscular impulse intensity and transmission grade. This process or the pathology, either the spondylosis, is also familial predisposition is present in this case also. That most of the cases are the traumatic one and the herniation of the disc.